Well, hello again, everybody. Welcome back into the Keep Boone Healthy information channel. Today is Monday, February 22nd. We are glad to have you with us, and some big news coming out of Watauga County Schools here the last few days. So we bring our good friend, Dr. Scott Elliott, superintendent of the Watauga County School System, here to share news on a couple of different fronts. So let's start first with some news that came out late last week, Dr. Elliott, about vaccinations and how that applies to Watauga County School System employees. Can you tell us a little bit about that?
This is my happy vaccine smile that I have on today. I have just been so relieved with the good news that we received last week. You know, we've been planning since back in January for any possibility for how we might be able to begin vaccinations for our teachers and school staff. And just through some luck, maybe some divine intervention, and a lot of hard work from our local public health department and hospital, it turned out that we, this week, on Wednesday, the 24th, will be able to provide a vaccine to every single school system employee who would like to have it. And we have over 600 of those who have signed up. And again, thanks to Jen Green and Chuck Mantooth and others, Sean Burrows and others who've been on your program before, for making that happen. A little bit of irony here in the high country with all the weather that we have, that we're benefiting a little bit from the weather that most of the rest of the country had last week, which then delayed the shipment of a large allocation of the vaccine to this community. And our health department's been doing such a great job of administering the doses they've been given that the state has doubled the allocation. All of that kind of came together during the same week, this week, that the governor said that educators could begin receiving vaccines in Group 3. And we're just so fortunate that we're going to be able to provide this protection for our employees.
And timing being of the essence here too, you get the opportunity to administer that vaccination on the date that it becomes available to this first part of Group 3. So no delay in that process. How will you handle the rest of that? Or has that determination been made on the second shot, and how you quite honestly staff this scenario too? I know this is something that we'll be talking with a lot of other Group 3 folks about as this process continues, but how have you and your team worked to make sure that you can maintain the staffing levels that you need while administering a vaccine that has some side effects for some people?
Yeah, great point. So again, kudos to the health department and the hospital for kind of having the logistics of this down pat. So the experience that we have observed with folks who've gotten the first dose of both the Moderna and the Pfizer vaccine is that the side effects of that first dose are fairly minimal. It's the second dose that tends to have some of those more pronounced side effects, localized soreness, nausea, fatigue, fever, things like that. So even though we are giving the first dose this week on a Wednesday, we have planned with the health department and the hospital to give that second dose on a Friday, so that our staff have the weekend to rest and recover and recuperate. It was either that, or if we had to give those during a weekday, we would probably need to stagger those out in a way so that if we did have staff vacancies as a result, that we would, that we could absorb that. But I think that by having those on a Friday, and that will be Friday, March the 26th, parents, mark your calendars. We haven't made a decision yet, but it will likely be either a remote learning day or an optional teacher work day, so that our staff can go and get the vaccine on that day. Teachers will be able to rest and recuperate, and hopefully will have a minimal impact on operations come that Monday morning.
So again, timing being what it is, this great news at the end of last week came with a planned work session for the Watauga County School Board already on the books for today. And earlier this afternoon, you were able to have a fairly lengthy meeting with your Board of Education with several other members of the community to spell out kind of the scientific where we are right now. What came from that meeting today?
Well, it was a long, thorough, but very deliberative, very thoughtful conversation that our Board of Education members have had. They have been very deliberate and methodical in the decision making all year long, and I think that we've seen the benefits of that by the fact that we've been able to keep our schools open. We haven't had outbreaks and clusters in our schools. We haven't had to close classrooms or schools, and so they wanted to be very deliberate as we move forward. They know that they want students to be able to attend school more days a week than just the 2 days a week that most of our children are attending right now. And you're right, it was very fortuitous that after scheduling the meeting today to determine how to do that, that we got the good news last week about the vaccine. But the outcome of the meeting today was that the board voted unanimously to move forward with moving our kindergarten through 5th grade students to what the state calls Plan A, minimal social distancing, which will allow us to bring the students in 4 days a week. So 2 weeks from today, that will be Monday, March the 8th, our pre-K, kindergarten, 1st and 2nd grade students will begin coming 4 days a week, Monday, Tuesday, Thursday, Friday. Wednesday will remain a flex day for all the things that have, that our staff have used those days for: deep cleaning, tutoring with students who need it, planning time together, things like that. 2 weeks later, on Monday, March the 22nd, we'll bring our 3rd, 4th, and 5th grade students back 4 days a week, Monday, Tuesday, Thursday, Friday. So by that week, we'll have all of our K-5 students back 4 days a week. There was some discussion today about moving to a 5-day-a-week schedule, and I believe the board will have some further discussion about that at their next regularly scheduled meeting on March the 8th. My hope is that we operationalize and are able to smoothly bring the K-5 students back 4 days a week. Then we look at making that 5 days a week and allowing our middle school and high school students to begin taking advantage of Wednesdays as well. It's still a little ways off, but we have a plan right now for how we begin to phase in these K-5 students, and there's a lot of excitement today about that.
So let's talk about the social distancing element of that, because I know that that was discussed quite a bit. How does that change with this operational difference now to bring students in for 4 days and have more students in the school than what you had prior?
That is a critical question about these operational plans that the governor and DHHS laid out. So Plan B is moderate social distancing with a requirement of keeping students 6 feet apart when they're stationary. So think of them sitting in a classroom, not necessarily in PE or running around or walking down the hall, but where possible, 6 feet apart. In Plan A, according to the governor and DHH's plan, is minimal social distancing. We try to keep them as far apart as much as possible, but a recognition that children, especially those ages 10 and younger, physiologically are less likely to get the virus, less likely to share the virus with someone else, and less likely to get as sick from it. That's the kind of the delineation that the state made with K-5. So we're going to attempt to create as much social distance and maintain as much social distance with those K-5 students as much as we can, but we know that we're essentially bringing back twice as many students into class. What we're going to try to do now, and believe that we can do this in nearly all of our classrooms, is keep them at least 3 feet apart. And we're encouraged by some research, particularly from the Harvard Global Health Institute and some recent publications from the American Academy of Pediatrics, that 3 feet of physical distance provides just as much protection, statistically anyway, as 6 feet. But we also know that it isn't just the social distance, and to some extent, it isn't even really the social distance that provides the protection. It's diligent mask wearing and the exclusion protocols when children are symptomatic or when they have been close contacts with a known positive, excluding those children and keeping them home. Those two things together, along with the social distancing and the hand washing and the cleaning of the facilities, are what we call sort of layers of mitigation strategies. And we have to keep doing this. We have to remain diligent about, just because we're moving forward doesn't mean that we've moved across the finish line. So we have to continue to do these things. But there is some concern about, how are we going to feed all the children? Where will we be able to space them out? Maybe with better weather coming, we'll begin to be able to take advantage of the outdoors again and some things like that. But we've seen enough research now, and we've heard enough recommendations from our pediatricians, from our public health officials and others, that we can feel more confident that with these other strategies, that smaller social distancing is still safe for our younger students.
So as we hear this now, can parents still expect to see some of the similar screening procedures, the mask wearing for kids, some of those same elements that we have become accustomed to now, from the drop off and pickup perspectives, bus transportation, those kinds of things?
All of it remains the same, David, and that's important. And all of those things have worked, and they are still all requirements from the state. So yes, in the car rider line, those questions that we've all become accustomed to, the taking of the temperature, we will have more students coming back to school now. So logistically, it's going to take a little bit more time. We're going to need a little bit more patience from parents, or parents need to perhaps plan for that. uh, but also the contact investigation and contact tracing protocols, all of those will remain the same. And we just need parents and teachers, staff to remain vigilant and diligent about all the things that we're asking people to do when they're not at school. We feel very confident about the health and safety of our students when they're at school. It's what's happening outside of school that is causing our students to contract the virus, sometimes our staff members to contract the virus. And we know it's going to happen. It's a pandemic, but we just ask that we continue to do the things to protect our children so that they can continue to come to school.
So we live in somewhat of a what comes next society. So I'll ask you what comes next when it relates to other grade levels that were left out of today's decision. And there's a reason for that. Obviously, middle school 6 through 8 looks a little bit different in Watauga County than it does in some areas throughout the state, with those students being along with their K-5 counterparts and pre-K for that matter as well. But what do you see happening with middle school and high school students as it relates to any further phasing them back into a building similar to what you're talking about with K-5 now?
It's a great question. So why aren't we doing this with our middle or high school students right now? So just as a reminder, through the governor's executive orders, school systems are limited to Plan B, no greater than Plan B, moderate social distancing, keeping students 6 feet apart for middle and high school. We're fortunate here that we have strong enrollment. Our school enrollment's actually been growing over the last few years, but that means that in order to maintain that 6 feet of social distance, we can only have roughly about half the students in attendance at a time. That's why we have the Plan B 2x3 model. So we don't know the status of that or if it's going to change. We know that Senate Bill 37 has been passed in the House and the Senate, and it's sitting on the governor's desk. Will he veto it? Will he sign it? We don't know. We know that he has until the end of the week to resolve that. It could be that he signs it into law, though last week he made a public statement saying that he couldn't support it. It could be that he vetoes it. It could be that the governor decides to modify the executive orders to try to implement some of the aspects of Senate Bill 37. We'll just have to wait this week and see. We also need to see about the success of moving our K-5 students back 4 and 5 days a week. So that we can then steadily begin to do the same with our middle and high school students when or if the time comes. But to be clear with folks right now, and I have a middle school and a high school child myself, I'm eager for them to be back in school for the foreseeable future. Our middle and high school students will continue on the Plan B 2x3 schedule. The board said today in their meeting that on March the 8th, their next regularly scheduled meeting, that they'll reevaluate the 4 versus the 5-day schedule. And it could be that it's foreseeable that maybe at some point the middle and high school students are coming in on Wednesdays still to be determined. But what we know right now, March 8th, K1 and 2, March 22nd, 3, 4, and 5, 4 days a week, Monday, Tuesday, Thursday, Friday, and then we'll see where we go from there.
I would imagine too that this all of this planning today comes with that I'll call it COVID life caveat that all plans are subject to change when and if those needs come about. What will you be looking at in terms of indicators to make sure that things are progressing forward enough to continue with the plans as you and the board have laid them out, or if something were to occur, we've seen flare-ups, hot spots, as sometimes the terminology is used. What would have to happen for you to pause or move backward at this point in time?
Well, certainly we hope that we don't, but it's not to be taken for granted. So, we've become so flexible and resilient this year, but we want to try to move forward. What will we be looking for? We'll be looking for the number of students who are COVID positive. We track those daily and weekly. We'll be looking to see any signs of secondary transmission in school. So far, we've seen very little of that. Will bringing more students back change that? We'll also be looking to see what effect it has on our employees, and particularly our classroom teachers. We've been able to cover a lot of absences and classrooms right now because of the extra staffing that we have with teachers' assistants. That won't be possible anymore because teachers' assistants will be back in their classrooms with their larger classes of students. We'll also be looking at our bus transportation system. That'll be one of the biggest hurdles for us to overcome in the next 2 weeks. Again, because of the state guidelines on social distancing on school buses. What I anticipate, though, is that we will continue to be as diligent as we have been as a community with mask wearing, exclusion of, staying home when we're sick, and all of the, hand washing and good hygiene. These vaccines are certainly going to make a big difference as well. And I really think that we're going to be okay. But it's not to be taken for granted. But if we have to, then yes, we may have to take a step backward. That would look like perhaps whole classes staying home. It might look like a grade level staying home. I hope not. It might look like a whole school being closed. And again, so far we've been able to avoid that. But our experience tells us that we know what we can do, we know what works, and we've learned from many school districts that are doing what we're about to do, and who tell us that if you continue to be diligent about those protective activities, you can do this and do it safely.
Yeah, and I think that's one of the other aspects to this that is so intriguing is the operational differences that you will be able to phase in over time. And I'm sure that was part of your deliberate planning as well, to make sure that scaling up to having a certain part of one school's full grade level capacity there with select middle school students wandering around in the same building. It's not always about just something as simple as saying kids come back to school. You've got cafeteria workers, bus transportation, facilities needs that need to be addressed. Do you foresee any additional change or any additional discussion at the state level about how you are allowed to operate at this point in time, short of a governor's order change or change in the DHHS guidance? Say that three times fast. Anything like that coming down the road that you can anticipate?
Well, I mean, the guidance that we receive is, comes from one of three places: from the governor's executive orders, from the DHHS guidance, which are really embedded in the governor's executive orders, or anything that might come through direct legislation, such as SB 37. So, do I anticipate changes? Yeah, I actually do. I think that DHHS is looking at the success of schools who've been able to bring more students back and do it safely. I think that we know more around the science of viral spread, especially among our younger children. And I think that with increased vaccinations, they will have greater confidence in perhaps giving us more flexibility in these guidelines. I'd love to see some flexibility, still safe, decision making, but some flexibility in the guidelines around bus transportation, and perhaps even the density requirements for at least our middle school students. But I know that they're being very deliberate about these decisions, and they'll give us this guidance in good time. And what we can do right now is to make the best decisions we can based on the parameters that are given to us. We've waited for a while to move forward with Plan A, but now you can see that the Board of Education is more comfortable doing that, and we'll work really hard to make this work and to be successful. And then we'll take whatever comes after that.
Well, I heard you say in your meeting today that Watauga County Schools are a group of rule followers, and I can say as a parent of Watauga County Schools children, I appreciate that diligence. We have seen other districts maybe bend the rules, shift them around a little bit, and have consequences because of that. We know that you and your team are making every deliberate effort to go through the checks and balances again and again to make sure that things are indeed safe, not only for students but for teachers and staff as well. So thank you very much to you and your entire staff for all of the hard work. I know there's still a lot of hard work left ahead, but this today a significant hurdle to getting back a little bit of normalcy for those kids that have been eager to get back to school for quite some
That's
time.
right.
So
Thank you,
thanks
David.
for all your work on that.